gentleman I was working with out of Indiana was hospitalized due to the complex nature of his medical condition. We've seen a high increase since 2020 with our COVID disability leave cases. With this gentleman, he was having severe symptoms, which led to a hospitalization for 21 days. With his disability leave, I worked closely with his spouse because he was unable to speak with me while he was hospitalized, and we were able to partner closely in regards to his medical treatment while in the hospital, and then discuss his outpatient discharge treatment plan. Looking at his case history, he had an overall healthy history. Was speaking with this gentleman after he was discharged from the hospital. I was able to find out some underlying comorbidities that he had from historical medical care, which led to needing some additional medical care following his discharge. So originally he was out for long haul COVID, but during all of his assessments following his discharge from the hospital, he was also diagnosed with cancer in the lungs. And the reason they found this out was because they were reviewing and evaluating his lungs due to his long haul COVID. He was the only person working. And so when I would speak with his spouse, she was really scared about losing health insurance and income. And she was super concerned that they were going to lose out on health insurance for herself, for her husband who was ill, and then for their children. So putting her mind at ease about having the 18 months of disability leave to have supplemental income, having a year and a half of health insurance, and for him being eligible to pursue long-term disability leave really put them both at ease. With his diagnosis of having stage 3 cancer, that meant we needed to get him set up with an oncologist. From there, we were able to determine what form of treatment we were going to need. At this time, he's getting treatment every 2 weeks with his chemotherapy along with reevaluations by his oncologist. So I closely speak with them every 2 weeks and closely worked with his oncologist in making sure that we have all the medical that's necessary to get him approved for long-term disability at the end of his 18 months of disability. For me, the most rewarding part of this case was recognizing the severity of his medical case and realizing that I should do an early referral for his Social Security disability benefits and getting his benefits approved before he even was out of work for 6 months. I know he was super concerned just with his overall health and with having young children and also wanting to get back to work and the change to his income. And so we worked closely with him on partnering with his employee assistance program he has through his employer. We also made sure to share with his spouse that she had services available through that employee assistance program, and if his children needed any services through that employee assistance program, we were able to coordinate any care that he needed for any type of counseling services or just individually for him or his spouse or his children, or any family counseling services, just to help them, through this situation they were going through.